Good evening, everyone. I'm Leah Cooper with your JCN News for this Tuesday, September 8th. Health Minister Renward Wells responds to claims that many have written letters to him about health care issues and they have gotten no response. Mr. Wells says that he has received no letters except one recently.
Well, let me say I've not received any letter from any individual other than a mother whose child that was recently delivered about a week ago, whose child needed emergency heart surgery, and there was the opportunity made for this child to be able to go to the United States to be able to have that life-saving surgery. I signed off on that letter as Minister of Health for the air ambulance to deliver that child. That child was delivered yesterday into Miami. That is the only letter I have received in regards to health care and health issues.
Recently, there have been posts circulating on social media about mothers who claim to have had terrible experiences in the Princess Margaret Hospital, with many of the mothers saying that they have lost children due to mistreatment.
The issues that we see in social media, obviously, anyone who has a heart, as the Prime Minister would say, or anyone who is just any individual, your heart would go out to. There's that sense of compassion, and you know, as a father and as a husband who has lost children, you know, just seeing the story brought back my own circumstances, and as such, PHA, I believe the managing director would have spoken to the issue as to the fact that we're looking into it.
The Minister of Health noted that the Bahamian people should also keep in mind that the staff within the medical community, both public and private, is stretched. He stated that the ministry will do all they can to preserve the lives of Bahamian people. As COVID-19 continues to wreak havoc on an already overwhelmed healthcare system in the country, Minister of Health Renward Wells revealed that the government has approved the hiring of 29 junior doctors who were made redundant back in July. That along with making provisions to hire more nurses. He revealed this much to the media just before the weekly cabinet meeting this morning.
We have about 54 nurses, student nurses, who would have come through the program, who need to sit the final exam. We're seeking with the nurses board to be able to have them sit that exam hopefully by the end of September. And that amount of nurses, whoever pass, we will bring into the system. Then there's the circumstance of just looking for nurses abroad, whether they are from India, from the Philippines, from Israel. I know that there was a number of overtures that was sent out to the international community.
The health minister added that prior to the pandemic, there were calls for some additional 100 nurses as the country had lost many of its nurses to international hospitals. Thus, this is another avenue in which the ministry is looking at for an immediate injection of nurses. He further adds this about the introduction of more health care workers.
This is not anything new. We've done this in the past. We've brought in Filipino nurses, nurses from India. We've brought in doctors from abroad, from India. So this is a normal course of business that the Bahamas has been doing even before we became an independent nation. So it is, but if we can find Bahamians who are willing to return home and to help assist us in this national effort, by all means, we would welcome it.
It's recommended that hotels will resume full operations on October 15th and that hotel workers be required to be tested for COVID-19 before returning to work. Minister of Tourism Dionisio de Aguilar says this much yesterday during a press conference, adding that it's required for tourists who enter the country to have a negative test, and so should all hotel staff.
Given that visitors to a hotel will have been tested prior to their arrival, it only makes sense that the staff is tested also to maintain the requisite environment to safely vacation in place. As such, after consultation with public health, the competent authority, and the hotel industry, the Ministry of Tourism is strongly recommending, actively encouraging, that all hotel staff be tested prior to their resuming work and on an as-needed basis thereafter.
The minister notes that he is aware that COVID-19 RT-PCR tests can be very costly. He says he's spoken with the public health officials for a solution to this matter, adding that employers are expected to fund the testing. He further notes that the government is not taking on that reliability.
So public health officials see no problem with hotel properties, and any other businesses for that matter, using, if they wish, far less expensive CDC-approved tests that have proven accuracy levels that are in striking range of the PCR gold standard test. These tests will be used for primary screening, and the PCR test will be used for secondary screening if the need arises. We are pleased that the public health officials have agreed that some form of testing, other than the PCR testing, can be used for this purpose. In fact, they have indicated that they view this as another layer of protection for our workers, together with the wearing of face masks, social distancing, and other PPEs that will be obligatory.
Now, when asked if the hotel or hotel employees will absorb the cost for the testing, Minister D'Aguilar stated that each business will do as they see fit, but if it were him as a business owner, he would absorb the cost for his employees. He added that the goal is to ultimately promote the health and safety of staff through a robust, holistic approach. The tourism minister says he's optimistic about the future of tourism and says with the support of every Bahamian, he believes that the Bahamas can achieve a full reopening of the tourism sector by early November. Construction sites now deemed a breeding ground for COVID-19. This coming from Prime Minister Dr. Hubert Minnis yesterday at a press conference in Grand Bahama. That said, he's urging all construction workers to wear their masks to eradicate the COVID-19 levels seen today.
As it relates to construction sites, the police will be monitoring sites to ensure mask-wearing protocols are being followed by all construction workers. Construction operations will now be fined for non-compliance with the orders related to mask wearing and other physical distancing protocols established by the Bahamas Construction Association as approved by the Ministry of Health.
On a second infraction, the PM adds the fine will be doubled, and on the third infraction, the construction project may be closed.
The workers' cooperation on the construction sites will help us to open our economy more smoothly, will help us decrease unemployment, will help us to invite our tourists and guests into our shores very safely.
39 new cases of COVID-19 added to the country's total as the Ministry of Health announced 38 new cases in New Providence and 1 on Abaco. Those cases bring the total in country to 2,585. Health officials also confirming the unfortunate death of an 81-year-old male of New Providence who died on August 14th. His death was initially categorized as a death under investigation. Therefore, that category has decreased from 16 to 15, and the COVID-19 related deaths has increased from 58 to 59. There have been 1,667 confirmed cases of COVID-19 in New Providence, 584 cases on Grand Bahama, 86 on Abaco, 54 on Bimini, 23 confirmed cases on Exuma, 15 on the Berry Islands, 13 on Inagua, 8 confirmed cases on Cat Island, Eleuthera and Long Island, 7 confirmed cases in Acklands, 3 confirmed cases in Andros, 2 on Crooked Island and Mayaguana, and 105 confirmed cases with locations pending. There are 1,496 active cases, 64 of them hospitalized, 1,008 recovered cases, and 13,010 COVID-19 tests have been completed to date. You're watching JCN News. Stay with us.
This segment of the news was brought to you by Alive.